My years of recovery from schizophrenia have taught me that meaning is critical to mental health. When I was diagnosed with schizophrenia about 31 years ago, I experienced the development of the illness as something like a starvation of meaning, meaning that I searched for meaning all around me in my life and in the world. And after a long time having trouble finding it or experiencing it, as the illness developed, I began to see it in places where no one else could see it. Perhaps it didn't really exist in reality. And this is a common feature that is often attributed to people with schizophrenia of the condition. After a while, I began to recover, and science played a major role in helping me recover with the development of innovative treatments, including new medications, cognitive training on a digital platform. These things were instrumental to my recovery, and they were developed by scientific research. Just like I had very great help for recovery from science, many millions of people around the world are also being helped by science for their recovery from serious mental illness. And these are many, many people that are being helped. I'm Brandon Staglin, and this is One Mind Brainwaves. Every day, groundbreaking research is discovering new treatments that can help people with mental health challenges and can provide hope for people with mental health challenges if only they knew about them. Today, we're going to talk with a leading neuroscientist about these discoveries coming down the pike and what they may mean for so many people who struggle. Later, we'll check in with our team from One Mind Cyber Guide about an app that may be able to help you with experiences of anxiety or depression. But first, his music is folk, blues, country, and honest. His new album, Strawberry Mansion, is about finding peace during the pandemic. We're so lucky to have with us today artist, singer-songwriter, Langhorne Slim. Langhorne Slim, thank you so much for being with us on Brainwaves.
It's my pleasure. Thanks for having me.
Yeah, great to see you today. Great to see you again. I remember seeing your concert about 10 years ago. Man, what a performance you gave, and been a fan of yours ever since then. Glad to see your star continue to rise.
Thank you, my friend. Nice to see you again after so many years.
Absolutely, absolutely. Such a pleasure to have you here. So I have a few questions for you first, then we'll play your song. So struggle was the word for 2020. It was a year of many storms, including a tornado which ripped through your neighborhood in Nashville. Sadly, I'm glad to see you come through it. And these storms and events figure prominently throughout your album, Strawberry Mansion, your new album. How did this album, you've just been going through a long writing drought as 2020 began. How did the inspiration for this album come to you? And how was that for you, that long writing drought? What caused that for you?
Yeah. Well, there's been a lot of literal storms, and for many of us, a lot of internal storms. And I had been continuing to struggle with some of those internal storms, but they really started to manifest in the creature. I'll put it to you this way. I think of it as a creature that lives within, and for me, that's addiction, that's anxiety, that's depression, and I can only speak for myself, of course. In my experience in this body, in this life, when I feed the creature gets more and more hungry, and it's something that I continue to learn that for me isn't something that is going to, perhaps I'll never slay that dragon entirely. What I've learned that I can do is connect with a community of people that also live with these creatures. And there's a support that I didn't know. In the instance of addiction, I'd quit drinking and drugs about 7.5 years ago, but I didn't connect with other addicts, alcoholics, or 12-step program, any kind of community like that. And so at that time I had thought, which I don't think is terribly uncommon, that just by quitting those things, which was a huge thing for me, and I think for a lot of people when they are able to do that, that would take care of the issue, that I would be the man that I always knew and believed I could be. And it did indeed bring me closer, but without any kind of tools or new dance moves to more gracefully dance through this existence of life. Life happens, and things come up, and things came up for me. Nothing that we could talk about it or not, because it almost doesn't matter. Not to diminish what they were, but if it wasn't one thing, eventually it would have been another. And I wasn't, I think, emotionally, spiritually, mentally equipped to deal with, as some might say, life on life's terms, and my anxiety and some of these other issues. Because I think of it, this creature doesn't just have one arm or two arms. It has a whole bunch of arms. And once it starts to get going, it has access to all those arms. And then the same things that I might be doing, the great irony I find of it is the same things that I might lean toward behaviorally to try and make myself feel better or more quote unquote sane, and eventually and inevitably are the things that drive me to utter madness, to learn to develop other techniques so that I'm not feeding the creature. And so a year leading into, it's a long answer, but it's the year leading into the tornado and the pandemic. In many ways, this last year for me on a deeply personal level has been one of the best of my life, incredibly. And that's because I've been forced to slow down. I've been forced to simplify my life. And out of desperation and necessity, I've been forced to try and learn some new dance moves, to get clean and sober again, and to connect with a community of people that get it. So yeah, I had some years off of drugs and alcohol. I managed to stay away from alcohol. I know I'm talking to you in Napa, a place that I do dearly love, a place that I learned how much I do love wine. And I managed not to go back to the wine and the booze. But some years ago, the anxiety was getting so much for me, and I didn't know how to deal with it. And I went to a doctor, and I don't think I was totally honest with who I am and what my tendencies are and all that sort of thing. And I wound up getting prescription medication, but it's the type of medication that, for me, it might help me a little bit at first, but I quickly start to use it more than I've never used anything as it's prescribed. I'll let it be known. And yeah, in my mind at that time, I thought I could manage that and control that and do that in a certain way that eventually it got a hold of me, exacerbated anxieties, depression. It numbs my connection to the source of my own creativity, to the source of what I deem as the divine, to my deeper, I don't know that I've experienced my deepest, but my deeper ability to love and to connect, not necessarily in a romantic way, but that as well. And then to my true friends, my family, and the greatest medicine in the world, music.
Wow. Langhorne Slim, thank you for sharing your story. It's profound to hear what you've learned about yourself and how others can benefit from your knowledge. It's just amazing to think about. You talk about this creature that lives in you and lives in others you connected with, and you talk about medicine to treat it, as well as not only pharmaceutical medicine, but other forms of medicine that you can experience in your life, and these dance moves that enable you to practice that medicine for yourself in a way and get through life better.
I'd like to, just not to be rude, but to interject real quick and say, I've always, if I could say anything that sounds like any kind of wisdom, I need to out myself by saying I've always enjoyed these sorts of conversations, and I can intellectualize things in my own way. I enjoy thinking philosophically and analytically. It's difficult for me to put things into practice every day. And that's the big difference. And I still struggle with it. And for instance, this last week, my anxiety stuff and depression stuff has really been sort of out of nowhere. Well, I don't know where it's coming from. Mm-hmm. And I have to remind myself go outside for a walk. I have to remind myself to reach out to people and not isolate myself, because my tendency is, perhaps it's that everything becomes fearful. And then, I go, and I know people can relate to this. I'll withdraw. I'll kind of get cold and hard. I want to love. I want to be loved, but I want to be left alone at the same time. It's a whole thing. And so any wisdom that I've learned, if I could even call it that, is just to try to continue to push through that as it comes up, because I don't necessarily believe, if I wait to just be cured of it all, I'm trying to embrace that it's a journey and it's a practice, and some days are gonna suck, and not to become totally defeated and deflated when it does suck, because I believe there's help out there. It's easy for me to get very overwhelmed, and I'm just sort of beginning to try and allow the words that I'm able to say and put together for the message to seep down into my heart and my soul and my spirit, so that I'm putting these things into action, which continues to be challenging.
Yeah, recovery is a journey. It's something that never ends, right? It's something you always can continue to do better in your life and do better for yourself and for your friends and family, your community. The part of, I think, a struggle that artists face is the touring and the performances that artists give is something that I think, from what I've heard from other artists, is can be hectic, but also sustaining in a way. But the pandemic interrupted your hectic touring schedule, but it also gave you time to focus on your health and your creativity. These raw, powerful songs on Strawberry Mansion, how did those come about? How did you write those? Did the lyrics just come pouring out in a sense?
They did. This collection definitely felt more so than I can remember. Maybe when I first started to learn to play guitar, and songs were coming quickly at it, if I remember correctly. I haven't had this many songs sort of just reveal themselves in such a short period of time in my life. And I could attribute that to certain things for sure. And then I also think these things are a bit mysterious and mystical. And I like to think of it that way. But certainly, it's not my tendency to run isn't all bad, and I don't want it to. It's brought me. It's who I am in ways, as far as I can tell. And I've been a touring musician my entire adult life, for about the last 15 or 20 years, and I have a lot of drive and a lot of passion to have lived that kind of life, and never really had a plan B, and did it when there was no money, and did it when there was some money, and never really worried about that part of it. How do I put this? I needed to slow down. I needed to come home. I was out in Los Angeles trying to finish another record, sort of in the throes of this relapse with prescription medication. I was unable to do it. I was unable to connect with people that I was meeting and old friends in the way that felt deep and healthy. And that situation progressed to when I got home, right before the tornado, right before the pandemic, I went and got help. I had to get honest with myself about it. I no longer trusted myself. I really didn't recognize myself. And I felt bad. I felt bad, man. And so I did. I went and got some help for that, and then came home and sort of got what felt like a little bit of a head start for what was about to occur, which of course I had no idea. But I needed time I think I needed time to be off the road. I needed time to get serious and interested and passionate about my spiritual health, if you will, which I think obviously playing music and touring, it can feed me, and I know others that do this, I think, would relate. it can be the greatest medicine, and it could also be an emotionally abusive relationship, and it could be very drained. It could feed you, it could drain you, it can exhaust you. There's a lot of energetic exchange, and if you don't really know how to protect yourself in that way, which I have a lot to learn in that department, and maybe more than anything, what I'm trying to say is it becomes habitual, that it's always something down the road that I'm looking for, always looking to find myself somewhere else. And therefore, I'm never really where I'm at. And that's, I'm using a lot of words because I do, to try to get my points across. But that's really the pursuit that I'm after, is now at my age, being sober again, I have a deeper desire. My deepest desire is to try and find more peace with wherever I sit, wherever I stand. And that's going to take some work, because I've trained myself, or I popped out that way. I remember even as a kid, I couldn't sit still. I was always tugging at my mom's leg, like, where are we going next, kind of thing, getting in trouble in school. So it's always been with me, and now trying to be cool, to just be still. And there was so much with the pandemic, with the political situation, with the social unrest. There's so much with the internet, all the digital road rage. There's so much chaos, madness, noise, trickery, fear, negativity, on and on and on. And within that time period, I was trying, perhaps for the first time in my life, to find some quiet within. And I think there was all of that came to a head, and the songs started to reveal themselves, perhaps because I was in a place of stillness while there was so much craziness all around.
That's beautiful. You're able to find that place of stillness after so much questing and so much looking to the next thing all the time, and going through those hard times. It's amazing, your story. Thank you for sharing it some more. And your song Panic Attack kind of goes into your experiences there. It talks about the struggles you went through, your agony, and also talks about, well, it's frankly, it's a catchy, upbeat song and offers some hope. What went into writing that song? What was the genesis for that particular song?
I'm just glad that it is a catchy, upbeat song, because if it was a real sad melody, maybe I tend to like songs that are catchy and upbeat, that are talking about some kind of miserable thing. But no, what went into that, it was, I had started to see a therapist a little over a year ago who suggested to me that, I was telling her that the part of the anxiety creature was alive and well, and at times it becomes somewhat debilitating. At least it becomes very difficult for me to do much of anything, and I'll continue to try and control it and push through it, but it's messy. I don't know how to put it in words, really. That's why I write songs, because I don't really know how to put these things in words. It manifests itself into a physical thing. The thought, whatever the thought is, becomes a physical kind of freak out very quickly. And I still am trying to learn tools to get ahead of it before I lose a day or a week or a month to feeling underwater, to feeling like I'm crawling out of my skin. And she went on maternity leave, and therefore we don't work together anymore. But I love this woman, and she was so kind and wise, and all that to say, I did not appreciate her suggestion at the time that she gave it to me, because it made me anxious, which was, when you're feeling this way, she said, do you ever go and play your guitar or sit at the piano or something? And I said, I do when I feel sad, maybe when I feel happy, maybe when I feel a little lonely, maybe when I feel good in company. But no, when I feel this kind of this form of anxiety, no, I don't do it, because I think, as I put it to her, like the instruments which I'm surrounded by in my house, they sort of, in my mind, are kind of giving me like a stink eye. Like you wouldn't know what to do with me even if you tried. And that's the lens that I see the world when I feel that way. Everything is scary. It's still not super easy for me to say that out loud, but that's the truth. Everything feels, there's a negative tint to everything. And even and especially the things that I love the most. And that can be in relationships or my music, whatever I am sort of the most passionate about. And so I said to her, no, and I didn't like where she was going with this even then. And she suggested, why don't you pick up the guitar when you feel this way without any intention, expectation to write a great song? Play it just to hear the chords, to hear the notes, to just enjoy it and just try. I think what she was doing is just to try to quiet my mind, get myself out of my mind, to quiet the critic within my mind, that everybody can relate to. And certainly creative people, when they're being honest, everybody's got it. And so I wrote that down, I think, and I put it in my pocket. And I didn't do it. And then this one day, it was a couple months into the pandemic, I was having an anxiety attack. And I remembered what she had said, and it just had all kind of rushed back from the time that I had called for help to going and getting the help and calling a healthcare professional on the phone, wanting to speak with somebody confidentially, filling out forms as far as, do you feel this way from 1 to 10? All of that stuff, it was hanging right in front of me because it's what I had just been through. And so it was, a lot of the songs on the album I don't say this in an ego-y way. It's just these songs really did reveal themselves to me more than I had to really labor to find the words. So yeah, it just sort of spewed out.
You were in the moment at that moment and re-experiencing in your mind all those experiences that you had with your struggles, and it just came pouring out. I mean, it's amazing that you could do that. What would you hope people take away? And you shared an amazing story. What would you hope people take away from your album and your story?
Well, I didn't sit down and attempt to write an album about mental health or about addiction or even about the pandemic or the tornado. It's just these things that were happening. And more so than ever in my life, I think these songs were sort of like journal entries. They were showing up day by day. I think that as low as I've ever felt and as much as I've struggled with my own stuff, I believe I was born with, for one reason or another, a sense of hope and optimism, that without that, I would probably not be here. I don't know where I would be, but it's what keeps me going. And what I hope is that going forward, I don't need to get my back so far against the wall in order for me to start to fight back. And that's what I have done within my own internal kind of personal struggles or whatever, is to allow them to get to a point that it's been my survival instinct that kicks in. That's like, yo, I'm not going to make it if I don't stop doing this, if I don't reach out for some help. And at this point in my life, starting to do some of these things, if I don't try and seek other, like going back to the dance moves metaphor, if I don't at least try to learn some different moves, I'm going to keep coming back to the same solution, the same situations. And I don't believe I have to live that way for the rest of my life. And I don't want to. I'm tired of this, of doing things the same way and getting the same results. I'm a slow learner, my friend, but I do have some that sort of eternal hope and optimism somewhere within my soul that keeps at least a light on, and sometimes a lot of lights on. And I think for anybody else that struggles, it may seem cliche. I know it did for me when I first started hearing these things. You're not alone. And in the 12-step program, there's all kinds of slogans. There's such deep truth to them, I've found. And something that's has helped me so much is to connect with other people. It's great to read stuff in a book. I hope people can hear things in my songs, and that can be life affirming, and we can connect through these truths that we live through, a lot of us. There's something so profound about connecting with other people who struggle in similar ways and have learned some new dance moves to be more graceful, to have a lighter step, and to see the beauty that's in this world. There's infinite beauty. There's always going to be infinite bullshit. I don't know if I could say bullshit on the show, but there's infinite ugliness out there too. And I think it's kind of our decision in certain ways. What lens we want to see the world through.
Yeah, that is so powerful. You've really helped me to see things in a better perspective. And I think you've helped our viewers in the same way. We want to hear your song "Panic Attack," which expresses what you just said, but in a musical way. It's in an art, it's an art form, right? So let's can we hear your song, please? "Panic Attack."
Absolutely. I called a healthcare professional. Want to speak to someone confidentially. Don't know just how I'm feeling, but I'm feeling feelings exponentially. Calm voice started asking questions. Said, ma'am, I was hoping for advice. Said, I'm feeling lots of feelings. Not a single one of them feels nice. She said, do you ever think about dying? Said, no, but sometimes I lie. Do you want to live? Said, yes, but I feel like shit. And on a scale of 1 to 10, do you feel anxious? On a scale of 1 to 10, do you feel scared? Said, I'm feeling lots of feelings. For some reason, I cut my hair. Sometimes my skin starts crawling. Sometimes the creature's calling. Sometimes the walls start caving in. Sometimes I feel isolated. Sometimes I feel so small. Sometimes I get irritated. Right now I feel it all. She spoke and I tried to listen. Said, son, there may be no cure, but I swear that life's worth living. It's the only thing worth living for. To my friends in the same position, I wish there was a cure, but I know that life's worth living. It's the only thing worth living for. I called a healthcare professional. Want to speak to someone confidentially. Don't know just how I'm feeling, but I'm feeling feelings exponentially.
All right. Wow. That is such a great song. I loved hearing your story again in the song, and everything you shared there is just profound and so beautiful. Life is the only thing we're living for. It's like we make our own meaning in our lives. I fully believe that through the work that we do, the connections we have with our people we know and love. Yeah. Thanks for sharing that great wisdom. And keep on walking that path, my friend. I mean, you've gone through so much, and you've learned so much, and I have really inspired by the resilience you've shown and that spark you have within you. So, I'm with you. I
The
hope
feeling
you.
is mighty and mutual. You told me a
All
little
right.
bit about your history and what you've been through, and it's inspiring. I think when we open up and we share these things, like I said, after hearing about a little bit about you, I felt an immediate bond. It's I think if we that stigma is still there, and we do have to fight through that. I didn't know that it was still there, but I know now it is still there, and we're making progress. But there's no shame, and if we feel shame about it, and we keep these things to ourselves, they only, in my experience, the creature just gets hungrier and hungrier.
Yeah, here, exactly. I know what you mean. Langhorne Slim, you've just been amazing on our show. Thank you so much for being with us today, and we'd love to have you back sometime.
Anytime. You
Sounds
know where to
great.
find me, and I'll come and see you in Napa. Don't let me drink
Yeah.
any of your wine.
Okay. Look forward to seeing you soon, my friend. Take care.
Thank you so much. Much
Thank
love.
you. Joining me now to discuss some of the innovative and promising brain research that is developing new treatments for people who struggle, Dr. Eric Nestler, Nash Family Professor of Neuroscience and Director of the Friedman Brain Institute at the Icahn School of Medicine at Mount Sinai. And I might add, also co-chair of our One Mind Scientific Advisory Board. Eric, thanks so much for all you do for us and for being with us on One Mind Brainwaves today.
Brendan, thank you so much for the opportunity to be here. And I want the viewers to know how much I've enjoyed my work with One Mind and what a privilege it's been to be co-chair of the Scientific Advisory Board.
Excellent, Eric. Yeah, thanks so much. It's always been a pleasure to work with you too. And I have to admit that I'll state proudly that I look up to you and have for many years in terms of your not only scientific acumen and achievements, but also the warmth and congeniality and support you show for people, not only who struggle, but just people you work with and who you know. So I think you're a wonderful guy.
Thanks, Brandon. And you should know that all of the scientists on the Scientific Advisory Board also look up to you. You're an inspiration for someone who's lived with a serious mental illness and has demonstrated that it need not define their lives. And we are all very impressed.
Okay. Well, thanks, Eric. Happy to inspire when I can. I'll keep trying. Thanks so much. So, Eric, I have several questions for you that may help bring some hope for people learning about these brain science innovations. And viewers, don't forget, you can post questions for Eric on our webcast at any time. Eric, why is science so critical to improve life for people who experience brain health conditions?
I think for several reasons, Brandon. First, I think even when we don't have all the answers about a mental illness, people with these illnesses or their families want to know that the illnesses have a biological basis. There's been an overwhelming stigma across the world about mental illness. And the more that science tells us about the biological basis of these diseases, the more those stigmas can be broken down. Secondly, science is so critical to bring along the new treatments that we need. You said yourself at the outset of how you've benefited from some of more recently developed treatments. All those treatments, any innovation of therapeutics that we derive require an increased knowledge of the illnesses and then translating that increased knowledge to the clinic, all requiring scientific research. And then ultimately, I'd say we still refer to mental illnesses sometimes as chronic illnesses. People oftentimes live with them throughout their lives or periodically recurring throughout their lives. But the only reason they're chronic or recurring is that we don't yet have cures. And so science is particularly needed now to bring us the cures for mental illness, just like we see more and more cures for other illnesses that affect different organs in the body.
Wow, Eric, that's profound to think about. Cures for serious mental illnesses. I mean, something that to me it seemed like a dream, but it could be a reality. And we'll talk more about that as we go. perhaps in the near future. But something that really excites me to think about. Thanks for noting that. And, you know, your lab's team at Mount Sinai focuses on the neurobiology of diseases like addiction and depression. And these are some of the most common mental health conditions that people experience. Why is it so important to help the public understand the meaning of your work in brain science in general? You said it helps to destigmatize mental illness, but are there other reasons as well?
Well, particularly we've gotten a reminder of how important addiction and depression are to society during the COVID-19 pandemic, where we've seen such a tragic increase in the numbers of people who are reporting depression or anxiety, who are thinking about or even attempting suicide, and who are becoming addicted to drugs. And we talk about the opioid epidemic, killing somewhere on the order of 50,000 Americans. That was before the pandemic, and that number has increased by a third or more during the pandemic. So we are talking about devastating consequences of these syndromes on humanity, and we need to figure out more about the underlying biology and then the associated psychological and social factors that are also critical in order to help people cope with these illnesses and do better.
Yeah, so part of the equation is the biological science behind the illnesses, and that can help develop biologically based treatments. But as you mentioned, there's other factors too, like the social factors that go into the people's experiences in their lives. And, I know part of the research you do focuses on epigenetics, which can be influenced by people's experiences in their lives to change how their biology works, which is pretty fascinating. And I want to ask you a little bit more about your research. Your research has shown that there is a relationship between depression and addiction, and we'd love to hear more about that. What are some of the findings that excite you the most in that area? And what findings that you've made in your lab do you think have the most capacity to do the most good?
Yeah. So I would say that work in my lab, but also many other labs over the last couple of decades, has helped identify, first of all, regions of the brain where we think chronic stress or chronic exposure to a drug of abuse produce their deleterious effects to cause these syndromes of depression and addiction. And what we've seen is that there's a lot of overlap in the brain circuitry involved. May not be so surprising to think of overlapping brain circuitry for these syndromes, because if you think of depression, it involves in many people a loss in the ability to experience pleasure, a loss of motivation, whereas addiction involves taking drugs that very much affect reward and motivation. And so we definitely see this convergence of stress and drugs on the brain's reward circuitry. And that what my lab has also done, along with others, is to identify some of the chemical changes that occur in these brain areas that mediate these deleterious effects. And ultimately, we want to use this information to derive improved treatments, although I have to admit that the ability to go from increased knowledge of the biology to better treatments is a long process, and it is still ongoing, but I remain as optimistic today as I was 20 years ago that we will get there.
Thanks, Eric, for that vote of confidence. And I'm optimistic as well. That's why we do the work we do at One Mind, and we do it with you. So thank you. So we're talking with a leader in the field of neuroscience about new developments and treatments that can inspire hope and do good. Dr. Eric Nestler is the director of the Friedman Brain Institute, as well as the Nash Family Professor of Neuroscience at the Icahn School of Medicine at Mount Sinai in New York City. And Eric, I'm going to ask you a quick question in just a moment, but I want to first say to the viewers, don't forget, you can post questions for our guest at any time. And also, please, if you have information that is useful to you coming from this webcast, if any of this information is helpful, please share this with people you know that can help them as well. Appreciate that. Eric, I did want to ask you a question about, we were talking about a moment ago about overlap between different brain conditions and some of the circuitry being the same and the chemical reactions being the same in the brain. Is that an emerging field of neuroscience that holds a lot of promise for developing better understanding of the brain and thus better treatments down the line, like cross-diagnostic research, so to speak?
Yes, I think so. So as you know, Brandon, the way psychiatry diagnoses mental illness today is still based solely on the way people present with their symptoms. So we talk to patients, we talk to their families, and based on their symptoms, we would diagnose a syndrome like depression or schizophrenia, bipolar disorder, addiction, and so on. And it's very sobering to think that here we are in 2021, and we still don't have a brain scan or genetic test or blood test that helps us make that diagnosis the way we would with diseases of every other organ system, right? For a heart, you get electrocardiogram, blood pressure, cholesterol measures in the blood, and if necessary, even a heart biopsy. We can't do any of that for the brain. So as we learn more about the biology of these illnesses, we are discovering that the behavior-based diagnoses are not perfect. We knew that, but we're now learning more about why they're not perfect and why there really is a lot more overlap across these behavioral diagnoses, meaning that what we learn in the context of one illness really can help us understand what's happening in others. The eventual goal, and I really think we'll get there, is that a person with a mental illness will go to a doctor, and the doctor will order a brain scan, a series of blood tests, genetic tests, and give a person a more meaningful diagnosis that will then guide treatment better. And it's taken much longer to get there. We're not there yet. 20 years ago, I would have thought we'd be here now, 20 years later. But I think it reflects the remarkable complexity of the brain. When I was in medical school 35 or so years ago, and we were told then about a molecular approach to cancer, that we'd cut out a person's tumor, profile it molecularly, be able to identify a key determinant of the cancer, make a medicine directed against that determinant, and treat that person, personalized medicine. Here we are 3 or 4 decades later, just beginning to do that in cancer. The brain and mental illness are far more complicated than cancer by orders of magnitude. And so it's just going to take longer, but we will get there.
I'm very confident we will too. I share your confidence in that. Some of the Rising Star awardees that Unwind has funded, thanks to your help in selecting them, have already done work in that area for more precise diagnostics of mental illnesses, as well as more precision ways to treat it more precisely, which is really encouraging. And we featured some of these on Brainwaves in the past, such as Connor Liston, Ian Mays. They've done amazing work in these areas, and many others like them. Yeah. So Eric, I want to ask you, we talked about the fact that it takes a long time for a discovery to actually get to be used in practice. In fact, I think the common average term is like about 17 years is how long it generally takes. How can the brain health community help to accelerate this process so people can access these innovations that they so well deserve and need more quickly?
Right. I think that that's a very important goal. You're absolutely right that it's taken too long. I think part of that delay, well, as we said, it's due to the complexity of the brain and these illnesses. But I think another part of the delay is something that we can address, that academic research at universities like my own, medical schools like my own, versus drug research, medication research, and pharmaceutical and biotech companies have largely operated in isolation of one another, in separation from one another. Academics do the research, they publish their work, appears in journals, we get more grants to do more research, while pharmaceutical companies and biotech companies try to mine that research as best they can. But there hasn't been the kind of interdigitation that I think is required. I think that academic researchers like myself need to push discoveries closer to the clinic, more working more closely with pharmaceutical biotech companies. And at the same time, biotech pharmaceutical companies need to be more closely aligned with academics to more rapidly translate discoveries into possible therapeutic ramifications. So it's something that we're working on. I know that the National Institutes of Health is very eager to draw closer ties between the two communities. And I think that we'll see more and more collaborative work like that be done in the coming years.
Yeah, I hope so. And we've seen some of that work already begin in past years, in which one of our rising stars that you helped to select, Scott Russo, who's at the Icahn School of Medicine at Mount Sinai as well, has collaborated with Johnson & Johnson toward the production of some potential medications that were in clinical trials for a while for depression. So I'm glad to see this is happening, and would love to help continue that process. Yeah, so I also want to ask you, on the same note, how can organizations work together, not only between the public and private sectors, but even within, say, the private sector or within the public sector, to accelerate the research around brain science and to bring these treatments to people that come from it?
Yeah. The world is so much more connected today than it was a decade ago. And what we've learned increasingly is the value of collaboration. No one person and no one institution can do it all. And it underscores the importance of creating consortia of different groups of people who do come together and share their data. I happen to be very fortunate to be part of a group called the Hope for Depression Research Foundation, which is a collection of 9 scientists like myself, all focused on particular aspects of depression. And it's been a phenomenal opportunity because the synergy that we can derive is very compelling. Insights and advances made in one laboratory translated very quickly to 8 other laboratories, quickening the pace of discovery. I think Unwind does that quite a bit through its Rising Star Awards, through the music festival program where you bring scientists together, and other scientific venues that Unwind provides. And the more that we can do that, the better. We need to break down barriers of information transfer. We need to get different groups of investigators in the academic world and the industry world to trust one another with their data. I think, sometimes issues of trust and concern about sharing intellectual property and eventual profits get in the way of progress. I think that the promise of progress is so great that there's plenty to go around, and that we just need to get people together to solve what I would call the world's greatest medical problems. There's very little that we can think of that would have a greater, more positive impact on humanity than conquering mental illness.
Yeah, here, definitely. And I want to take a step back and go into more detail on what you're saying about the Hope for Depression Institute that you work with, that work. In terms of, you say it's accelerating research to get to discoveries faster. Are there certain discoveries that have been made by it that could help people with depression in the near term? And what progress have you made there?
Yeah, absolutely. So that's a really good point, because I know that patients oftentimes and their families oftentimes get frustrated by the slow pace of research progress, waiting for advances in the clinic that will actually be of day-to-day help to them. One of the discoveries that came from a colleague of mine at Columbia University, who's part of this HDRF consortium, found that there's a novel antidepressant called tianeptine that's approved in Europe, but was never approved in the United States. And it seems to be a pretty good antidepressant medication, but no one in the United States can benefit from it because it's not approved for use by the FDA. Why isn't it approved? Well, it went off patent, and no pharmaceutical company has the has the financial benefits prerogative to move forward with it. The Columbia scientists discovered that one of the ways in which tianeptine may be an antidepressant is by activating a receptor in the brain for opioid drugs. It's called the opioid receptor, say the morphine or heroin receptor. And tianeptine seems to act on this receptor in a unique way so that it doesn't make people or animals addicted, but it elevates their mood. It actually goes back to what we were talking about earlier of the real direct convergence between addiction and mood mechanisms. So this has led to a clinical trial sponsored by HDRF now to prove that point in humans. And once it's proven, it will lead to drug discovery efforts that are also underway to make new molecules with this particular type of opioid mechanism that can be given to people to treat depression without producing any addiction liability. And importantly, this is a mechanism that is not shared by any currently used antidepressant. So this presumably would help people with depression who don't benefit from the range of medications that we have available today.
Fantastic. That's so helpful. Because I figure I understand is it's like a third of people do really well with antidepressant medications in terms of it improving their symptoms, reducing their depression. About a third of people have some effect from it, and about a third have no effect from it, right? And so having multiple options for different treatments could be really helpful for more people.
That's right. So that you're precisely correct. It's about a third, and a third. And one of the other things that we could possibly do with this discovery is when a person comes to us who's depressed, we can actually assess opioid mechanisms in their brain with brain imaging and say, gee, you don't have any evidence of an opioid receptor deficit. We're going to give you a different medication, but you, this other person, you do have evidence, and we're going to give you this new medication, which we think might be particularly beneficial.
Personalized medicine, like you were talking about before.
The early stages of a personalized approach to psychiatry.
That gives me a lot of hope. That's fantastic. So, Eric, we're going to finish with the fun part of the show. The most fun part of the show. It's been fun already, but the most fun part of the show. We call it the lightning round. I'm going to ask you 5 questions.
That's a challenge for me, Brendan, because that means I actually have to be brief in my answers. I'll remember that. Go ahead.
As a neuroscientist and a professor, it will be a challenge for you.
Exactly.
Speaking stereotypically. Great. Okay. So the lightning round is, I'll ask you 5 questions, and I would like very quick answers, as you said. And the whole process will last 30 seconds or less for all my questions and your answers in total. You ready?
Ready to go.
Okay. What inspired you to go into the field of neuroscience?
I fell in love with neuroscience in school. I did my PhD in neuroscience, and then I had the opportunity in medical school to try all different specialties, and I fell in love with psychiatry. I really enjoyed working with people with emotional disturbances.
Fantastic. What area right now has the biggest potential for a major breakthrough?
Biology will take more time. I think one of the greatest breakthroughs may come from digital technology and then computer learning for people. So digital technology meaning capturing symptoms of people as they're getting sick very quickly so we can intervene early in their illness. And then also using computers to help people think and feel about things in different ways to treat their illnesses. I think both of those approaches are occurring quite robustly and can offer people advantages today.
Very, very hopeful. How about a cure for a serious condition? Which one and when, possibly?
I don't know when we're going to have cures. Cures are tough, but I think we need to be disciplined and not be satisfied with anything short of cures. I think a discovery of the genetic contributions to mental illness, coupled with the non-genetic, environmental, social, psychological contributions, can lead us in the direction of finding cures eventually. That's obviously going to take a longer period of time.
Mm-hmm. What activities or hobbies help you unwind and de-stress?
Oh my gosh. I kind of spend more time working now than I think I ever have before. I used to like to say that my greatest leisure activities were going out to dinner in New York City and going to shows and opera in New York City. Alas, for the past year, we haven't been able to do that, which has been extra stressful. So like everybody else, we watch TV and movies as much as we can on television.
Okay. And what gives you hope?
What gives me hope is the recognition that the technologies and tools that we have available to study the brain today, I could not even have imagined 20, 30 years ago when I started my work. The approaches are so powerful and the advances are now coming so quickly that I think we will finally, at long last, begin to see the advances like what we've seen in cancer, cardiovascular disease, and other aspects of medicine. We need to see that now for mental illness.
Definitely. Dr. Eric Nestler, thank you so much for sharing your perspectives, your wisdom, your expertise with us on brainwaves today. Viewers, thank you too. Thank you for watching. We'd like to take a moment to take a look at one of the many digital resources that might help with anxiety and depression, like we've been talking about today, like Eric mentioned as something that gave him hope earlier, as for breakthroughs. And for that, we turn to our team at OneMind Cyber Guide.
Hello, my name is John Bunny, and I'm a digital mental health specialist at OneMind Cyber Guide. We spend lots of time talking to people about mental health apps, what they like about them and what they don't like about them. In our research, we've heard from lots of people that one barrier to using mental health apps are concerns about privacy and security. This is understandable, as in some cases you might be entering sensitive, private information about your well-being, which you don't want other people to see. Just like any other technology you use, you should only use apps you trust and are confident in their ability to protect your data. Any app you use should have a privacy policy that informs you about how the app handles your data. In a recent study, we found that over half of apps for depression don't have a privacy policy. You can check for a policy in the App Store at the bottom of the app page. If an app doesn't have a policy or you are unsure of the security of the app, avoid using it. At OneMind Cyber Guide, we review privacy policies to check if key pieces of information about what happens to your data are covered in the policy. We believe developers should be as transparent as possible about how they handle data, so you can make informed choices about the apps you use. Sanvello is an app aimed at helping users manage their mental health, ranging from symptoms of anxiety and depression to improving general well-being. The app is based on techniques of cognitive behavioral therapy, or CBT, a gold standard in mental health practice. On the home screen of the app, you'll be greeted by a feed of information and suggestions for exercises to try or educational content to learn from. You can access a suite of tools which include guided meditations, educational courses to help you develop skills for managing your mental health, a thought journal to help you gain insight into patterns of thinking and how to reframe negative thoughts, a section for tracking and setting personal goals and challenges, health tracking to help you understand what might be affecting your mood, and inspiration boards for when you're struggling. If you're interested in reviewing your progress, there's a section where you can track the activities you complete, your mood, and the results of various check-ins. You can also access a community forum where you can interact with other Sanvello users to give and receive support. If you sign up for the premium version of Sanvello, you'll also be able to access coaching and individual therapy services, along with additional exercises and courses. We reviewed Sanvello at OneMind Cyber Guide, and it scores highly on our credibility scale, scoring 4.33 out of 5, and on our user experience scales, scoring 4.58 out of 5. It also has acceptable transparency around data security and privacy. You can learn more about Sanvello on our app guide at cyber.guide/Sanvello. Stay tuned next week for another app review.
Thanks, Cyber Guide team. Viewers, thank you too. And Eric, thanks again.
Brandon, thank you very much for having me today.
You're welcome, Eric. Appreciate you being on. Don't forget, viewers, you can post questions and also check out all of our past Brainwaves episodes at onemind.org/brainwaves. Thanks, everybody. Have a great week. See you next week.
Every day trying to find the strength. I just want things to go back to normal.
Science is racing to find treatments for the virus. Vaccines are on the horizon.
I don't know what to do.
But what about the mental health research needed to sustain our lives during and after the crisis? OneMind is funding the science to revolutionize treatments and provide hope. OneMind, accelerating brain health for all. Help us fund new treatments at onemind.org.